name is Michelle Tapia, and this evening we will be talking about anxiety. Anxiety affects 40 million adults in the U.S. each year, which is 18% of the U.S. population. I would first like to explain exactly what anxiety is, the types of anxiety disorders, along with their symptoms. Then the causes of anxiety disorders, and lastly, how they are treated. According to www.dictionary.com, anxiety is defined as the stress or uneasiness of mind caused by fear or danger. Everyone experiences some type of anxiety at one point or another in their life. You might feel anxious before your first day of school, first day at starting a new job, or maybe before a big exam. These types of anxiety are normal. There are several anxiety disorders that go far beyond everyday normal anxiety. The first anxiety disorder I would like to talk about is generalized anxiety disorder, or GAD, G-A-D. People with GAD have excessive, ongoing, severe worry, which creates tension and makes daily functioning quite difficult. They worry constantly about everything, such as everyday issues, household chores, family health, and their jobs. They tend to always expect disaster. Eventually, anxiety takes over their life, making daily functioning impossible. www.adaa.com states that GAD affects 6.8 million people each year in the United States. This is 3.1% of the population. Women are twice as likely to be affected as men. Symptoms of GAD, according to www.webmd.com/anxiety, are excessive worrying, restlessness, irritability, muscle tension, headaches, sweating, nausea, trembling, tiredness, using the bathroom frequently, trouble with sleep or going to sleep. The next anxiety disorder I would like to talk about is panic disorder. People with this disorder have sudden attacks of terror. These attacks are called panic attacks. The panic attack can occur suddenly with no warning at all. People who have the panic disorder develop a fear of having another attack. The fear can start to affect their daily lives and their functioning. According to www.webmd.com, panic attacks are accompanied by pounding heart, sweatiness, weakness, dizziness, and faintness. Some people believe they are going to have a heart attack or are losing their minds. Other symptoms of panic disorder are pounding heart, weakness, choking sensation, tingling fingers and toes, feeling that you are about to die, sweatiness, dizziness, nausea, chills, and hot flashes. The website www.adaa.org states that 6 million adults in the United States experience panic disorder. That is 2.7% of the U.S. population. Social anxiety disorder is another type of anxiety disorder. This disorder, according to www.adaa.com, affects 15 million adults each year, which is 6.8% of the population. This disorder, unlike the two previous disorders, affects both men and women. Typically begins around the age of 13. People with social anxiety disorder become anxious and excessively self-conscious in everyday social situations. They worry about what others think of them, if they are being judged or criticized. They can worry for days or weeks about a social situation. The anxiety over social situations can lead to panic attacks. This disorder can affect one's school, work, social activities, and their daily routine. Symptoms of the social anxiety disorder are intense anxiety in social situations, avoidance of social situations, Physical symptoms are confusion, pounding heart, sweating, blushing, and muscle tension. The last anxiety disorder I would like to talk about is specific phobias. The specific phobia is an intense fear of a specific object. Common objects are snakes, heights, flying. The level of fear of these phobias are usually inappropriate. When one is faced with a specific phobia, it may bring a panic attack or severe anxiety. Some of the other symptoms are avoiding objects or a situation, pounding heart, nausea and diarrhea, sweating, trembling, shortness of breath, lightheaded, and feeling of choking. And this affects 19 million adults in the United States each year. It's 8.7% of the population. So what causes anxiety disorders? www.webmd.com/anxiety states the exact cause of anxiety disorders are unknown. Many of the disorders are believed to be caused by several factors, including functioning of the brain, severe or long-lasting stress. They can be inherited or possibly triggered from a traumatic event. Anxiety disorders are treated by psychotherapy and medications. These two treatments can be done alone or together. Psychotherapy counseling tries to reduce the anxiety symptoms. Medications help to reduce anxiety, depression, and panic attacks. Anxiety disorders affect many people in the United States each year. The exact cause of anxiety disorders are unknown, but if one is committed to get help for their disorder, there is treatment available and it is successful. Thank you.